Hello, my name's Fiona Black and I am the colorectal enhanced recovery nurse. This is my colleague Maggie Nicol, who is a consultant anaesthetist, and we're here today to talk to you about surgery school. Exactly. So the reason that we've got you here today is that you're all coming in for a bowel operation. So we like to meet up and see you beforehand, but obviously in light of what's happened the last year, we're not able to meet you face to face. So in an attempt to get to you, we've made this video. So I apologise in advance. We are novice. We're just trying to get the message across. You will have been sent a pack, which you should have, which will have all the information in it that we're going to talk about today. So we'll just commence with the talk, if that's all right. Everybody that comes in for elective bowel surgery is automatically classed as an enhanced recovery after surgery patient. And what that means is it's all the most up-to-date, clinically proven practices to get you better are incorporated into a booklet which follows you through your hospital stay, and we endeavour to get you back to your pre-hospital stay in a nice, timely fashion. So in the last couple of years, we've actually taken a step beyond that, and instead of us seeing you just when you come into hospital, we endeavour to see you prior to admission, so that we can get you training for your surgery, because evidence shows that if you do some exercise and training, it will help you get out of hospital quicker, it will help you recover quicker, and it will help you feel better because you'll be more empowered and know what's going to happen. So we named it ERAS, that's Enhancing Recovery After Surgery Extra, and the extra stands for exercise and training. Now your surgery, you're all classed as having major surgery, and Maggie will agree with me. Major surgery has a big impact on your body. So we liken that to your body doesn't think, oh, I'm having an operation. All your body thinks is something really bad has happened and I need to go into self-preservation mode. And the best way to explain it to you is to say it's like running a race. So it's like running a 10K race, the effects, the chemical effects and the effects that happen in your body. Do you agree with that, Maggie?
I think so, that's right. And you wouldn't expect to go for a run, certainly I couldn't, without doing some training for it, because the effects of the running isn't just when the operation finishes, it continues for a couple of days afterwards, where your heart and lungs have to work together harder to deliver oxygen to your tissues to make everything heal nicely. So any improvement you can make on your health before you come in, or your fitness, is really, really important, no matter what short a time you have.
So you're coming in for surgery. So the decision's already been made to progress you to surgery. That's an operation. So next step is surgery school. And in the current climate, we're not going to see you face to face. So unfortunately, you have to listen to us via this link today. You will be sent an invitation to come for a pre-assessment visit. And this incorporates a lot. There's a lot that happens at that. We check bloods. There's lots of questions, and we're endeavouring to find out about your health, and we're trying to keep you safe so that you're optimised for surgery. And Maggie has a big impact on that.
But that may change at the moment, because we've introduced an electronic system, which means you can fill out all your information from home. So you may not have to come in and see us. It would be great. Of course, you have to come back at some point, but when you see the surgeon, we're going to try and capture you at that point and do any investigations that are required. So we reduce your return visits to the hospital as much as possible. We understand how much you don't want to be here, so we're trying to address that.
We're going to ask you today to increase your activity, and the reason for that is we're asking you to try and increase your muscle mass, and we're asking you to increase muscle building and practice with a device called an incentive spirometer. And this is all to endeavour to reduce your risk of post-op chest infection, which is a very high risk when you come in for any major surgery. So we'll talk a bit about that as the talk goes on. Once all that's done and everybody's happy and all the checks have been done, you will be admitted to hospital. Now, you will be coming in the day before surgery. So the date that the surgeon has given you, expect to come in the day before. And that lets us get all the paperwork and the blood's rechecked, your consent signed, and gets you all fit for the day of surgery. Critical care, post-operatively, some patients will go to critical care, but not all patients, and some patients will go directly back to the ward. When you have your pre-assessment visit, that will be decided at that point. And obviously some people just need a closer eye kept on them, so they will go for 24 hours to critical care, and some will go straight back to the ward. But we will let you know about that when you come into hospital, and it's all based on your physical fitness, your past medical history. But these decisions are made at your pre-assessment visit and as you come into hospital. Now, enhanced recovery is proven if we return you to diet and fluids early, it will improve your recovery and it will decrease your risk of wound infection. So we return you to diet and fluids very early, but we will keep you right on that. We will advise you, and also we mobilise you really very early, because this helps to reduce the risks associated with surgery, things like DVTs, clots. It also helps the bowel to move on a bit quicker and gets the bowels moving, which makes you feel a lot better and gets you home quicker. So that is my job. I come and see you every day and just coax you through that journey. So I'll come in, I work Monday to Friday, and you'll get a visit from me, and in my absence, my colleague Hazel will come and visit you.
This is a wee bit of a complex slide. It's trying to describe the 3 areas where the fitness for surgery has been addressed over the years. If you look at the lines to the left, your level of functional ability, what you're able to do before you come in for surgery. If you go to the surgery, see the surgeon, and you hear the news that you have to have surgery, a lot of people feel that they have to kind of wrap themselves in cotton wool. They have to look after themselves before they come in, which leads to a wee bit of a drop in fitness level. When they have their surgery, which is shown by the yellow band, it does knock your fitness quite a bit. And in the traditional path, you went down in fitness quite a long way and took a long time to recover, which is the green pathway. When enhanced recovery was introduced, and that was something Fiona's done for the last 5 years, yes, you still tend to wrap yourself in cotton wool, but Fiona and her colleagues catch you just after the surgery insult. And so although you do drop in fitness, you don't go down so far and you recover quicker. So where we are coming in now today is we want to catch you before you come in, emphasize the need for your fitness, encourage you to do as much as you can to get that wee bit fitter. So when you do come in and have the surgical insult that your body sees it as, you don't drop so far, you recover quicker, and hopefully you recover to a better level of fitness than you had before. All good reasons to get out there and start walking. So we're going to say what we can do now, and I'll leave that to Fiona.
So the things we're going to talk about today are, there's 5 things: getting active, chest training, muscle strengthening, eating well, and living well. And at this point, I need to tell you, don't panic. We're not going to ask you to don the Lycra and go for a 10k run. It's all based at your level. We're just asking you to increase it from your level. So we're going to talk about these in more detail now. So activity is vital in the run up to surgery. It's really important that at the point of your surgery, you are as fit as you possibly can be. So Scottish Government recommendation is that we should be doing 30 minutes of aerobic activity daily. Aerobic activity means activity that makes you short of breath. Whatever way we do that, there's lots of different ways, and we're giving you paperwork for that, but 30 minutes is a long time. So we are going to ask you to increase your activity regardless of how fit you are at the moment. We don't ask you to do 30 minutes all in one go, because that's rather a long time. to be short of breath, we ask you to break it down and perhaps into 10-minute slots, so 3 10-minute slots a day. And it's exercise that makes you short of breath. Now, it's not a bad thing to be short of breath. It's actually good because it means that your heart and your lungs are working harder. So you're training them. So we've put a few examples of how you can do aerobic activity. Moderate to brisk walking is perfect. And a good way that we describe how to do that is the lamp post test. So if you're out for a walk, you walk from the first lamp post to the second lamp post at your normal pace, and then from the second to the third, walk as if you're going to miss the bus. So you speed up, which makes your heart work harder and your lungs work harder and makes you slightly short of breath. And then from the third to the fourth, you can slow down. The fifth to the sixth, again, speed it up like you're going to miss that bus. And that just helps your heart and your lungs to train for your surgery. Another, if you're in the habit of jogging's very good. Swimming's good. Swimming pools are closed right now, but hopefully in the coming months, they're going to be reopening. So swimming's very good, and especially if you've got joint problems and you're not able to walk, swimming's ideal. It's a very good exercise. And even walking in the swimming pool, Maggie came up with that, just chest deep and just walking, it's very, very good, and it makes you short of breath. But remember, short bursts, not aiming for 30 minutes all in one. Cycling's very good. On a rainy day, walking up and down the stairs is very good. So you can adapt it to whatever you need to do. But 30 minutes a day is what's recommended, but not all in one go. Obviously, we don't want you to get chest pain or anything like that. A bit of shortness of breath is good, but if you have chest pain and you need to stop, of course you're going to stop. We're sensible people. It's just telling you that we do need you to be a bit short of breath. Then you recover, then you can start again. So you have a handout that came in the pack we sent you that has lots of exercises in it. And these are geared at people who are both fully mobile and people who are less mobile, so you can adapt it to your needs. And it's just hints and tips on how to exercise prior to your surgery. They're very good, they're very simple, but I would urge you to have a look at them. Next part of the homework we've got for you is chest training. Now you're maybe wondering why we are asking you to do some chest training when you're getting an operation on your bowel, but anybody who has an anaesthetic is at an increased risk of getting a post-operative chest complaint, and that's generally a chest infection. It's the #1 most common post-op complication, and it's because you're lying flat on an operating table, having an anaesthetic, so that's not a natural position to be in. On top of that, Maggie or her colleagues are delivering an anaesthetic to you, so you're not breathing for yourself during the duration of your operation. We're breathing for you with machines. So we're very, very good at doing it, but there's no substitute for being upright and taking deep breaths yourself. So Maggie has lots of hints and tips during her anaesthetic that keeps your lungs big and filled. But regardless of that, you're lying down, so you are at higher risk because the secretions tend to sit static and they sit at the bottom of your lungs and they become infected. So we have a technique which will assist you in doing that, and we're going to do a demonstration at the end.
Okay.
And we'll add it in. We may incorporate it at the beginning. But we'll have a little gadget. Maggie's got it in her hand called the incentive spirometer, and we will show you how to work that. And this little gadget is vital to your post-operative recovery. This machine can reduce your risk of a post-op chest complication by 50%. So when we show you the video, I strongly urge you to practice this before you come in. You have a patient information booklet, and on the back there is a little graph. When you practice using it, it asks you to do 6 breaths, 4 times a day, and you can tick it as you do it. Okay, but we will show you how to work that. But I really, really urge you to use the incentive spirometer. Now, as part of the chest training, we have a little acronym called ICOF that we ask you to incorporate, and I'm just going to talk about that now. The I stands for incentive spirometer, and that's this little gadget we're going to show you how to use. C, when you have surgery, it's vital that you can cough, because what I said about chest infection, it's really important that you can clear your lungs of any secretions, and it's also really good that you can deep breathe. But unfortunately, because we're giving you an operation, you've got to have a wound in your tummy, whether that be a keyhole wound or a larger wound, and this sometimes can inhibit you taking a deep breath because you're in pain. Now, if you're in pain, what you tend to do is take a less of a deep breath, so you take a shallow breath, which means that these secretions never clear from the bottom of your lungs. So it's really vital that you can cough and deep breathe with good pain control. So if you find that you can't take cough or you can't take a deep breath, that means that you're in pain and you need to ask the nursing staff for pain relief. You will be having pain relief given to you, but sometimes it's not adequate. So it's important that you tell us, I can't cough, because we need to fix it, and we will fix it. But it's important that you tell us. There's no prizes for being a hero in hospital. You have to tell us if you're in pain, and a good measure for you is I can't cough, it's too sore. The O in ICOF stands for oral health care. Now, we do hark on a lot about chest, but the human mouth has got naturally lots and lots of bacteria in it. So when you come in for surgery and the anaesthetist pops a tube down to help you breathe during your operation, some of this bacteria can inadvertently pass down into your windpipe and into your lungs, which can cause a chest infection. Okay, so what we ask you to do, if you don't mind, is the week before you come in for your surgery, we ask you to purchase an antibacterial mouthwash. Now, as long as it's antibacterial, any make will do. And what we ask you to do, if you've got dentures, when you do your teeth in the morning, you can rinse with the antibacterial mouthwash straight away. And we ask you to do it twice a day, the week before you come in. If you have your own teeth, what we ask you to do is to clean your teeth and allow the fluoride in your toothpaste to do its work. So wait 15 minutes before you rinse with the antibacterial. And this helps to reduce the amount of bacteria in your mouth. So when you come in for your surgery, there's less bacteria there, so there's less risk of it travelling down into your lungs. The U from ICOF stands for understanding the patient education, and it's really about what we're telling you today. And if any of it doesn't make any sense to you, please phone us. My number's on the back of the patient information booklet. No questions are silly questions. So if I'm not making myself clear, please phone me and let me know, and I'll try and explain it in more detail. The G stands for getting out of bed after surgery. Evidence strongly shows that lying in bed is bad for you. It's not good for your lungs. It's not good for your legs. It reduces your muscle mass. So we are aiming to get you up and get you moving in a nice, timely fashion. So we start slowly. So day after your operation, expect to be out of bed. Expect to go a short walk, because we're trying to return you to your pre-hospital state in a nice, timely fashion. And I will be in there to egg you on, to encourage you, and to get you through that part. And we start very small and we just build up. As you get better, we just increase it. The H, the last part, is head of bed elevation. Lots of studies done on post-op chest infections and chest complications, and it's proven that if we keep the head of your bed slightly elevated up to 30 degrees, it really reduces the risk of post-op chest complications. So please don't be alarmed if you're lying in your bed and I pop in and you're lying flat and I just bring the back of the bed up. It's for a good reason, and it's just whilst you're in hospital post-surgery. I'll pass you to the expert on pain relief.
The anaesthetist who sees you before your operation will discuss more at length about what type of pain relief would be best for you and the operation you're going to have. At the back of the leaflet you'll be sent out, there's a link to the Royal College of Anaesthetists website, which gives very, very good and detailed information, certainly about epidurals and spinals. And these are devices or techniques that we can use to ensure that you have good pain relief for a number of days afterwards. The epidural involves an injection in your back where we leave a little plastic catheter and drugs are infused through that to help keep your nerves that are your pain nerves in your back not transmitting the signal of pain. So that keeps you nice and comfy afterwards. Spinal is a similar type of procedure, but is a one-off, one-shot injection in your back with a strong painkiller, again designed to keep your tummy comfortable for probably 24 hours. We often add to that by using the PCA, which stands for Patient Controlled Analgesia. So you may have seen sometimes on the telly, people have a button to press, and that will deliver a dose of pain-killing medicine directly into your cannula in your vein so that you will get an immediate effect from pressing the button. If you see Fiona coming down the corridor and you know she's going to try and get you out of bed, it may be sensible to press your button then so you've got a nice layer of comfort when she's going to get you up and about. The surgeons here have introduced things called wound catheters in the last few years, where a plastic tube is inserted beside the wound and local anaesthetic is infused down that catheter, and that can be for a number of days afterwards and can be very effective about keeping your tummy nice and comfortable. I absolutely agree with Fiona. You have to be comfy, or a level of discomfort may be expected, but if it's too painful to cough or deep breathe, you must ask the nurses and they would get some assistance to make your pain relief as good as it can be. Really important.
So let's talk now about muscle strengthening. It's really important in the run up to your operation that we try and increase your muscle strength, and this helps you in a lot of ways. When you come in, of course your mobility is going to decrease, so you are going to lose a little bit of muscle strength in the days following your surgery. So if you have increased that prior to surgery, you're at an advantage already. There's lots of ways we can increase muscle strength. Gardening is perfect, and any type of gardening is very good for increasing muscle strength. Housework's very good. Hoovering, washing the windows, dusting, all these types of things are really important. Lifting weights. Now, I'm not asking you to go and buy some dumbbells, but filling a litre bottle of water or 2 bottles with, up and using them as weights is very important. And Maggie often demonstrates the best way to do that. The muscles that we need you to strengthen are your upper leg muscles and your arm muscles. You will need these in hospital because hospital beds are fantastic for keeping pressure areas good and stopping you getting pressure sores, but they're very difficult to sit yourself up the bed. So if you can strengthen your arm muscles in the run up, it will just stand you in good stead. So a bottle of water in your hand, and just doing this with a bottle of water with both your arms, or lifting it above your head, both arms, and just dropping it down and lifting it up. These all increase these muscles here, which will help you to sit up the bed. This will be in your booklet, your mobilisation and your exercise booklet. So have a look and have a try. Another very simple way is sit to stand. So simply sitting in your chair at home, not a chair on wheels, and just sitting and standing and sitting and standing. You get up to 10 times, and the more you do it, the more sure it gets on your legs, and that shows you that you're strengthening your muscles. So that's another one, but again, it's all in your booklet, so have a look. Resistance bands are the little elastic bands that you can tie around the leg of your chair, and then you can lift your legs up and down. But again, it's in your booklet. And often a pair of tights stands just as well as a resistance band because they're stretchy. Push-ups, if you can't do them on the floor, which I can, you can do them against the wall. So standing with your arms against the wall and just pushing forward and back. Very useful. Have a go, see how you get on. So things that you can do. There's lots of things that you can do. We're giving you lots of orders. I'm so sorry. We're very bossy. Post-surgery, what happens when the surgeon handles your bowel, and he needs to do that for your operation, the bowel really does not like to be handled. And often it slows down or stops for a day or two, which can make you feel a bit seedy, and it certainly takes your appetite away. So things that we ask you to do in preparation for coming in is bring some chewing gum in. We don't like you to chew it before surgery, but we like you to chew it post-surgery because it starts your gut to work. It just starts your metabolism going, and it can encourage your bowel to start working again. So often a pack of chewing gum, when you don't feel like eating anything, it can give you a nice taste in your mouth as well. So bring a pack of chewing gum in and chew it post-surgery. Bring in your favourite snacks. Because your appetite takes a big hit, and you don't have much appetite, and then you've got me coming in every day wanting to know what you've eaten. Sometimes you can tempt yourself to eat if you've got your favourite things. A bar of chocolate, it's very easy to break off a square of chocolate and eat it. And it's getting calories into you because calories are what heals your wound. So we're trying to give you calories, and we often give you milky drinks that are full of calories as well, and it's just an attempt to get your calorific intake up, because with the best will in the world, you're not going to meet your needs in the first few days because your metabolic rate's going to shoot way up because we have given you surgery, so your body's trying to heal itself. So things that you like to eat, for me, it would be a packet of shortbread, it would be cheese XL crisps. For Maggie,
it's Jaffa cakes.
Jaffa cakes. Bring in your guilty pleasure and have it. A packet of boiled sweeties full of sugar, easy to suck on, gives you calories. So bring them in. Bring in some non-fizzy juice, because we've all been encouraged to drink lots of water. Some people don't like the taste of water. There's no taste really. So a bit of diluting juice is a good idea. We ask you to eat little and often because there's no appetite, so we're coaxing you to eat, and we have these little supplement drinks, and that's just to endeavour to get calories into you. And be guided by the staff. I will keep you right what you're meant to be, and we have very specific diets for you, so we will keep you right what you can and can't eat. Your appetite will come back, it just takes a bit of time. But it's very important that you try and get some calories in the early days. And often the wee guilty secrets, the little pack of shortbread, the little bar of chocolate, is what gets you through. Or a packet of digestive biscuits, even, very easy to eat. Don't think with this slide that we're asking you to stop drinking, we're not. But the National Health in Scotland guidelines say that a maximum of 14 units a week of alcohol is what's recommended. And we all, some of us drink some of us drink nothing, but it's just important that we just tell you about this. If you are a regular drinker, what we ask you to do is not to stop. If you take a drink every day, please don't stop drinking, but we ask you to moderate it as you come into hospital. Drink, but try and have a drink over 3 days a week as opposed to every night of the week. We're not telling you not to drink, but it's being sensible in the run up to surgery. There's evidence with alcohol intake, isn't there, Maggie? And
it can lead to more confusion afterwards if you're used to drinking, and obviously you won't be drinking in the hospital. So if your body is used to having the alcohol, not having it can contribute to a post-op confusional state. So we'd be really keen that you'd cut your levels down before you come in. If you can't, please do let staff know, and there are drugs that we can maybe give you, some B vitamins which may actually reduce the risk of developing the confusional state. So be honest with us, but do try and reduce. It's difficult times at the moment, and alcohol is quite a crutch for some people. So do just look at what you're drinking and see if that can be moderated before you come in.
And the little paragraph at the bottom is very important. If you drink regularly and to excess, it's really important that you do not stop drinking completely, because that can have an adverse effect. If you stop suddenly, it can make you unwell. So please, if you are in this category, please seek expert help and advice, and the numbers there at the bottom, which is also in your patient information booklet. If you're a smoker, we do ask you to stop. We're not going to beat about the bush on that one. We do really ask you to try and stop smoking. It's really important. So we'll put this slide in, and we'll also put the number for the professionals that can help you with this. But no half measures with the cigarettes, I'm afraid. We do like you to stop smoking.
The toxins in the cigarette smoke, actually, the things that are there bind to your red cells, your red blood cells, 200 times more than oxygen. So actually physically stops your body's blood carrying oxygen, which obviously has got an impact on your wound healing. So we can't stress this enough, that we would really, really like you to stop. There's also help with patches and things in the run up to the surgery that we can help to deal with the nicotine cravings. Do ask for help, please.
When you're in hospital, it's really important that you're comfortable. You've got a wound, so think about the clothes that you're coming in with. Please don't go out and buy lots of new clothes to come into hospital. Bring in your comfortable clothes, whether that be elasticated waist, shorts, t-shirts, loose-fitting pyjamas, nighties, whatever you're comfortable in, but comfort is paramount. But it's essential that you've got good, firm-fitting footwear. We're going to be mobilising you. You're going to be a bit anxious in the early days, so good, firm-fitting footwear is important. So please don't feel the need to go out and buy new fluffy slippers. We would rather, if your slippers that you've got are firm-fitting, bring them in. If you've got a good pair of training shoes or slip-on shoes that are good and firm-fitting, bring them. Please don't bring flip-flops. They are a trip hazard. We just want you to have good firm-fitting footwear. We don't want you, it's not a fashion parade, it's comfort is important, and safety. So, for your recovery in hospital, what we'd like you to do is, we're going to, and I will run you through this, we're going to encourage you to use your incentive spirometer every hour. In the run up to surgery, we ask you to practice 4 times a day, but once you have your surgery, that's when you're at most risk. So we're going to ask you to practice every hour, a couple of breaths every hour, but I will keep you right on that. Pain relief is very important. There's a big difference between pain and discomfort, and of course you're going to have some discomfort, but we never want you to have pain. So if you've got pain, you can't deep breathe or cough, please ask and we'll fix it. Mobilise with the help of the nurses and the physios. Believe me, I will be mobilising you. But we take it at your pace, and we just encourage you every day to increase it slightly, because we're endeavouring to get you home in a nice timely fashion. Eat and drink when advised. I will keep you right. The staff in the wards are all very well versed on this, so we will keep you right on the eating and drinking. And by allowing you to drink early, it means we can get rid of these drips in the IV fluids, which makes you more independent. It's quite boring in the hospital. You're in a single room on your own. If you've got anything that you like to do, simple puzzles, if you like a Sudoku or a word search, bring them in. Bring in a good book if you're a reader. Bring in your tablet if you like to use that, and you can use it to FaceTime your family as well, because you need to occupy your time, and it's not everybody that wants to sit and watch the television. So bring in what you like to do. If you're a knitter, bring in your knitting, whatever your favourite is. And the little sentence at the end, you're not sick. I'm sure you'll agree with that. You're coming into hospital for a procedure, so we don't intend to treat you as if you are sick. We're hoping to get you home in a nice, timely fashion, get you back to your loved ones, and get you back to your physical fitness in a nice, timely way. Hopefully, more fitter if you take pre-hospital exercise to heart. That's our aim with this. Now, this slide, we popped this slide in after we initially brought in the surgery school, because it came to our attention from patients that sometimes, and I'm sure you'll agree with this, when you realise that you need surgery, often your mood can be affected by this. Some patients have a cancer diagnosis, some people don't, but regardless, you're coming in for major surgery, it's going to disrupt your life and disrupt it for quite a few months. And even the run up to surgery can take time. It's quite frustrating waiting for scans. So your mood can be affected, and it's important that you give yourself a break in this because it's normal. The run up to surgery and the post surgery period is an emotional roller coaster, and you can have highs and lows throughout it. So it's important that you know that you're not, there's nothing wrong with you. It's just normal, and this is part and parcel of surgery, I'm afraid. So pay attention to your feelings. Yes, you're going to be grumpy some days. You're going to be angry. You're going to feel a bit frustrated. Things aren't moving quick enough. But rest assured, this will pass. Your family do sometimes suffer at your hands because your mood suffers, and I'm sure they understand, but it's important that you know that this is normal. And this is just some examples of how it can make you feel. You can feel nervous. Of course, you're going to be worried. You're coming in for surgery. You can be sad. You can be frustrated. So we've popped these slides in so that you know that you're not alone in this, and that everybody feels that this is coming in for surgery. But rest assured that in just about 99% of cases, this will pass. You will get back to where you were. You will feel happy again, and all these feelings will pass. I'm sure you can all relate to this. We're all human beings, and we feel anxious, we feel worried about things, and we overthink things, especially when you're coming in for surgery. But it's entirely normal to feel like that. And for most of us, these feelings will pass, and you will go back to your old self. However, if you feel that these feelings are not passing, if the thoughts and behaviours are really problematic and you're not getting over them, and if they're taking over your life, you need to seek help. Whether that be through your family or your GP, or you can phone us, we can put you in touch with people to help with that. It's very unusual, but it can happen, and it's important that you realise this and seek help if you need it. So best way to manage these feelings when you're feeling like it is be actively involved in your recovery. If you're feeling a bit dull and frustrated, a walk in the fresh air can make you feel so much better. It can just lighten your mood. It can just take your mind off things. It's a very good thing to try, even in the post-operative period, because I will be encouraging you to go for walks. Follow the advice given by your family, your friends, by us. Know that these feelings and thoughts, though unpleasant, they will pass, and you just need to give it time. And it's important to remember that you're still you. You're still the same person that you were before, and there's no reason not to think that you'll get back to doing exactly what you were doing before. You just need a bit of time to recover. Do things that fit with who you are. So what's important to you should still be important to you post-surgery. So you should be looking to get back to hobbies, things that you like to do. And these small things can make a big difference, like watching a film. Hopefully the cinemas will be open soon. Go to the cinema, reading a book, whatever you like to do. If you like a bit of bacon, get back to the bacon. Me and Maggie like a bit of bacon.
Aye, we do.
We do. Listen to your favourite music. Hopefully we'll be able to visit people just shortly, so go and visit. Just do what you like to do. There's no reason that you can't do it. These are just examples. Everybody's different, so it's important that you do what matters to you. Now this slide is at the end of this. you may have questions that you need to ask us specifically. So both mine and Maggie's and Nicole's number are here. Please feel free to phone us. Some of you will have been in touch with Leanne Porteous, the colorectal nurse. Her number will be available to you as well. Don't be afraid to phone us if we don't know the answer to the question, and we'll soon find it out for you. Thank you very much for attending.
Well done. We wish you well with your surgery. I hope some of this has been helpful to you. And as Fiona says, we're here for questions should you need things answered or clarified. So we're here to help. Okay.
And take the time to look through the paperwork that we've sent you. And please do practice with your incentive spirometer. You will notice in your pack we've also given you a pedometer. It's a little white box and it's got a pedometer in it. Now there's a little plastic part that you pull that starts it. And on the back of your information sheet, there's a little graph. And if you choose to, you can write your steps that you take in every day, because we're asking you to increase your steps, remember. So if you're a fairly average fit person, we would ask you to use the pedometer for a couple of days and see what your average steps are, and then increase it by 500 steps a day. But even if you only increase it by 100 or 200 a day to run up, you're still making an improvement. The little button on the top, you just press it and hold it, and it will return it to 0 at the end of each day, so you can start the next day. And it's an incentive for you to see if you are making any progress in the steps. And if you have it clipped on you for the minute you get up to the minute you go to bed, you'll be amazed how many steps you're actually taking in a day. So increasing it gently just means that you're doing the right thing and you're helping yourself to recover better from your hospital admission. Anything else you want to add, Maggie?
I think that's it.
I'd just like to apologise at the end, because we are not actresses. Helen Mirren, I am not. So we've done our best just to get the message across, but please don't judge us. We've done our best.
And what we're going to try to add now is a wee additional bit of video to show you how to use the incentive spirometer correctly. So that will be coming up shortly.
Thank you.
Thanks for listening.
Fiona, I'm just going to ask you to demonstrate how to use the incentive spirometer. So this is what you'll take out of your little plastic bag. The blue tubing just pulls off and it gives you a mouthpiece and the blue tubing. If you look at the little device with the balls on it, there is a little sticky out bit beside the white ball where you can attach the blue tubing, which is Fiona's going to show you now. So the aim of this device is actually not to blow into it, but to suck, to make the balls rise up in the air. So the best way to do that is to hold it quite close to your face. Maybe Fiona, if you stand sideways, you might be able to see it, or I know, yeah. Just to see it's up level with your face. And then Fiona's got to turn back to face us so we can see the balls going up in the air. So I'm going to ask you to breathe out to the room as if you're blowing out birthday cake candles. Okay, 99, 100. Put the mouthpiece in and then give me a big suck. Big, 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 big. Hold it. Perfect. So that was a perfect breath from Fiona there. And you can see how much it expanded her chest. What we would like you to do is 6 of those breaths 4 times a day. Now, if I asked Fiona to do 6 of those breaths now, one after the other, she would pass out, because it gives you a tremendous rush of oxygen to your brain. So be sitting nice and upright and just do slow breaths, but try and do the 6. Here we go again. Breathing out, sucking in, suck. And Fiona's brilliant. We've practiced this. If you can't get the 3 balls up in the air, try your best. Just try and get the number that you can get up. If you can get the 3 balls in the air, like Fiona, hold it for as long as you can. That's perfect. We hope you enjoy this. If you want to have a competition with family members, rinse the blue tubing.
Oh, only got 2.
It's only 2 that time. Rinse the blue tubing in hot soapy water, and then they can have a shot. So you have a family competition. Excellent. Because we usually find the men have got quite a lot of competitiveness. Okay. This will make a difference. as we said, it reduces the post-op pulmonary complications by 50%. Put your name on the side, there's a wee label, and bring it into hospital with you, because they tend to go missing in hospitals. So we want to know that you've got yours and you'll be using it every hour post-op. Good luck.